India's fight against malnutrition. Welcome you all to Saral Bharat News, where I, Shivam, going to throw some light on this report made by Mr. Vinay Namdev. In a bid to tackle malnutrition, the government is developing an atlas to map the crops and food grains grown in different regions of the country, so that nutritious, protein-rich food in local areas can be promoted. The Ministry of Women and Child Development, in association with the Bill and Melinda Gates Foundation and Deen Dayal Research Institute, is developing a Poshan Atlas under Poshan Abhiyan, government's multi-ministerial convergence mission with the vision to ensure attainment of malnutrition-free India by 2022. So what is this malnutrition means? Malnutrition refers to deficiencies, excesses or imbalances in a person's intake of energy or nutrients. This term malnutrition covers two broad groups of conditions. One is undernutrition, which includes stunting, low height for age, wasting, low weight for height, underweight, low weight for age, and micronutrient deficiencies or insufficiencies, a lack of important vitamins and minerals. The other is overweight, obesity, and diet-related non-communicable diseases such as heart disease, stroke, diabetes, and cancer. So, what would be the causes for this malnutrition? Mother's health, social inequality, sanitation, lack of diversified food, lack of food security, disease spread, poverty, lack of nutrition. So, what would be the measures needed to remove this completely? Anganwadi system is the backbone of India's nutrition target effort, and we really have to improve it. Primary health infrastructure is not so strong, so proper steps needs to be taken in this regard. Farmers should be encouraged and incentivized for agricultural diversification. Innovative and low-cost farming technologies, increasing the irrigation coverage and enhancing knowledge of farmers in areas such as appropriate use of land and water should be encouraged to improve the sustainability of food productivity. Public health management cadre. The government should improve policy support for improving agricultural produce of traditional crops in the country. Improve ICDS. The targeting efficiency of all food safety nets should be improved, especially that of the targeted public distribution system (TPDS), to ensure that the poorest are also included. In addition, fortification of government approved commodities within the social safety net programs can improve nutritional outcomes. Child feeding practices should be improved in the country, especially at the critical ages when solid foods are introduced to the diet. Fortification, diversification and supplementation may be used as simultaneous strategies to address micro and macronutrient deficiencies. Storage capacity should be improved to prevent post-harvest losses. There is a need for more robust measures that can take cognizance of all aspects of SDG 2. All the major welfare programs need to be gender sensitive. The inherited dehumanizing poverty explains the persistence of malnutrition on a very large scale. Children born in impecunious circumstances suffer the most from malnutrition. It is all the more reason for governments to intervene to provide adequate nutrition to all of them, taking medical services to the doorstep of villages. Funds for food to all yield great returns and help in unlocking the full potential of citizens, besides strengthening the workforce. Focus to improve the hygiene and cleanliness of our surroundings. Real-time delivery of such schemes to the targeted beneficiaries. Schools, kids and their parents should be made aware of the various government programs. So, this was all. If you really liked it, then like the video, share it and subscribe Saral Bharat News for more updates like this. And if you like this report of Mr. Vinay Namdev, then go through the link given in description to visit the official website of Saral Bharat News to read it. So be connected with Saral Bharat News. Thank you so much.